Hello and welcome to Fineprint. I'm Bhairavi Singh. Tonight we focus on healthcare workers and those on the front lines of this fight against a pandemic. We start with the United States. Well, the United States is the worst affected country in the world right now, with over 2 lakh positive cases of coronavirus, which is showing no signs of abating. American hospitals are inundated with patients, and making conditions worse is the shortage of medical equipment, protective gear and medicines. The otherwise bustling metropolis of New York is the worst hit in the country, as the number of coronavirus cases have surpassed 83,000 and over 2,000 deaths have been recorded in NYC alone. It's a race against time for the medical professionals in New York City as they continue to work in an exposed environment where they are most prone to contracting the virus. In such harsh times, various videos have surfaced on social media where the doctors can be seen sharing their ordeal. They are confessing that they are completely overwhelmed by the increasing number of cases.
Hi everybody, my name is Dr. Mona Lisa Muchatuta. I'm an emergency medicine doctor in New York City. I'm making this video with my colleagues here in New York to try to help you understand how serious COVID-19 is, to encourage you to stay safe, to stay home, and to kind of give you a better idea of what's going on in New York City, just so you can really take this seriously. Hospitals are running out of medications. Some hospitals don't have protective gear for staff or family members of patients that come to the hospital. We're running out of medications, we're running out of equipment, and we're even running out of oxygen, which is something that patients that have COVID-19 need. So we don't want to test your immune system in this day and age. If you're feeling unwell, stay home. If you're exposed to somebody, stay home.
Despite the amount of information available in the public domain, there are still some people who think that coronavirus can infect only the elderly. A doctor was seen busting that myth.
Hello, my name is Dr. Benjamin Obasaki, and one of the points I just want to touch on with this disease is that there's a common misconception going around that it's only the elder people in our population that's being affected. This is simply untrue. Every day we are having people, younger adults, come in who have very little comorbidities or other illnesses going on, who are being seriously affected by this illness, affected to the point to where they have to be put on a ventilator just to breathe.
So the coronavirus pandemic is continuing to spread exponentially in the United States. President Trump acknowledged that the coming weeks are going to be extremely tough for Americans and has asked them to follow all guidelines strictly. The number of confirmed cases in New York, as we said, has surpassed 83,000 and death toll now stands beyond 2,000. In the coming weeks, the administration is likely to further be crippled by insufficient medical equipment and drugs. Reports suggest that the U.S. could be in dire need of ventilators. Experts have asked for 75,000 more ventilators to be battle ready for the peak virus spread coming in the few weeks. Hospitals in the U.S. could also face shortages of critical antibiotics like erythromycin that are promising to treat COVID-19 symptoms. Now, New York City is now a hotspot of COVID-19, and the city's hospitals are being filled with patients. With an aim at combating the shortage of medical facilities, the engineering arm of the U.S. Army has also converted a convention center into a 1,000-bed hospital. The Army is also on a search for hotels and other large spaces to build more hospitals. In New York City's iconic Central Park, hundreds of volunteers are also working around the clock with an aim to have an open-field hospital with 68 beds and 10 ventilators to treat COVID-19 patients. Meanwhile, in California, nearly 10,000 people have tested positive. In order to provide relief to patients with other conditions, the U.S. Navy hospital ship Mercy has also docked at the Los Angeles port. The hospital aims to treat more than 1,500 people and has a capacity of 1,000 beds. In Santa Clara and San Francisco Bay Area, members of the California Air National Guard have set up hospital beds and other necessary medical equipment. The convention center will hold close to 250 beds and will assist bigger hospitals in hosting patients with mild